Great, thanks very much, Ben. So we're going to move on in the interview now to do some economics case studies. And what we're really looking for here is to just have a bit of a conversation and unpick how you think like an economist. So we'll give you some scenarios and we want to talk you through some of the key economic factors that are in play there. So what we're looking to understand here is really about how you take all of those economic concepts that you've learned on your course and apply them to real world or fake world situations. But what we're definitely not trying to test here is how much you know about the policy environment in the UK or anywhere else. So I'll give you all of the detail that you need to have. Feel free to write things down. Feel free to ask me if anything's unclear or if you want more detail or something repeated. That's all absolutely fine. We're certainly not looking to test how much you know about this already.
Okay.
Great. All right, so to start us off, I'll give you a bit of an introductory blurb on this question. The government funds a network of Sure Start centres for families with children under the age of 5. The centres offer a variety of services, including basic health services, access to childcare, and classes about child development. The services are free to access, and they're available to anyone living in the neighbourhood of a centre, but the centres themselves are concentrated in more disadvantaged areas. Does that all make sense?
Can I ask how big a neighbourhood is?
Neighbourhoods are roughly about 1,500 people, but in practice, the centres were eventually extended so they covered the whole country. So you get more, you have more centres close to you if you're in a disadvantaged area, but everybody by the end of the program had access to some of these centres.
Okay.
Great. So to start us off, can you think of any reasons why the government might be interested in providing these kinds of services?
Well, I guess governments are interested in providing services to children right through their education. Governments don't just leave schooling to parents. We also might care about what happens before they reach school. Those interventions in early years might help better prepare them for school, make them perhaps have better nutrition, maybe develop some sort of skills that might better equip them to then pursue education. And by targeting it at more poorer areas, poorer neighbourhoods, might try to narrow some of those gaps between what children in more privileged areas might get to what children in more poorer households might not. So it might be about kind of narrowing socioeconomic gaps also.
Yeah, that's a really good point. I want to push you a little bit more on the first point that you made. So governments have an interest in intervening in schooling or in some of these earlier services. Why specifically from a sort of economic point of view might governments have an interest in doing that?
You might think there's broader societal benefits to having a well-educated population, people who are perhaps better schooled, have better education, better childhoods, maybe are less likely to go on and commit crimes or to end up kind of in prison. Maybe they're more likely to be productive members of society, contributing to other people. So that's what you'd call a positive externality. And so government might want to promote those sorts of activities. So you could think about it like that.
Fantastic, absolutely. And what about on the parents' side? Can you think particularly around access to childcare? Would there be any reasons for government to intervene there?
One thing you might worry about is whether or not parents are able to work could be affected by the availability of childcare. And if you don't have the income to pay for childcare yourself, if government provides free childcare, that might allow people to work who otherwise wouldn't have done.
Okay, great. So we're going to move on now, and I'm going to give you an excerpt from a research team which has released a new evaluation of these Sure Start centres. So their report concludes, children who regularly use Sure Start centres have better test scores and fewer hospitalizations than children who don't visit the centres at all. This provides strong evidence that Sure Start is an effective program, and the government should open a centre in every neighbourhood as soon as possible. What do you think of this report?
I would want to see more detail, but from what you've said, it sounds like they're just comparing two groups, the children who went to Sure Start and the children who didn't go to Sure Start. And my concern would be that they're not comparable. Maybe parents who take their children to Sure Start centres are more invested in their children generally in ways that we can't see. And so you might worry about selection bias in this sort of study. And then I guess there's also a question of whether just because something works in particular neighbourhoods, would it work in the country at large? And whether this sort of programme has application to broader society, or whether it only works when it's small and targeted.
Great. I think those are two really, really important points. So on the first point that you raised there, you sort of flagged up that more ambitious or eager parents might be more willing to use the centres. Can you think of any selection bias that might go in the other direction?
I don't know how selection for kind of these, I guess you said it was available to everybody in a local area. You might wonder, presumably attendance rates aren't 100%, and maybe, you might have teachers putting forward their most troubled kids to try and get them to go to these classes, so maybe you get kind of the most vulnerable children or the most troubled children going, so maybe you could have selection bias the other way. Or perhaps via the parents as well. Parents who are, going to access welfare services might also be pushed to access Sure Start services as well. So it could go the other direction.
Yeah, absolutely. And I guess thinking also about where the centres were located, we know that they were more concentrated in some of those disadvantaged neighbourhoods too. So people in those neighbourhoods might find it easier to access the centres as well. All right, fantastic. So I think what we've taken from that is that we don't think that report was particularly good. But now imagine that you've convinced the government that this report, could do with some work. And now they've come back and asked you to evaluate the Sure Start program to understand specifically the causal impact that Sure Start has had on children's hospitalizations. So you have access to help you with this. You have access to a data set of all hospital admissions in England, going back 5 years before the program was introduced. How might you improve on the original research report?
So can I ask about something you said earlier about the Sure Start wasn't available to everybody immediately. It was available to some neighbourhoods. And was that kind of all at once, or did some of them open at different times?
That's a great question. So they opened over a period of about 12 years. Initially, they were targeted at the most disadvantaged neighbourhoods with a couple of clear criteria, but eventually the push was sort of to roll them out everywhere as quickly as the government feasibly could do.
Okay, so I guess one thing you might do is look at one particular neighbourhood before it had a Sure Start centre, and look at hospital admissions in that year, and then the year after, or the years after, once it was introduced, and see if there's any sort of change, and you could do that, with lots of different areas. Another way to think about it might be two areas that look similar, but one gets a Sure Start centre and one doesn't, and maybe compare what happened, if there were different trends or different rates of hospital use in each of those. Particularly if maybe there was, I don't know how these criteria worked, but maybe if there's some sort of cliff edge or cut-off point, maybe someone just above and just below the cut-off point might be one way to think about that as well.
Okay, yeah, absolutely. And so if we did, let's take maybe the first method that you're suggesting. So we look at a bunch of neighbourhoods before they get Sure Start and after they get Sure Start. And we just look at hospitalizations in that neighbourhood. What does that tell us about the impact of Sure Start? Can you describe in words who we're looking at the impacts on, or what specific effect of the program?
So you're looking for effectively being exposed to Sure Start, in this case, would be like a treatment. And what we're looking for is the average treatment effect of opening a Sure Start centre.
Great. Yeah, so it's this intent to treat idea rather than looking at people who are necessarily specifically using the services. That's great. And so the final question on this case study, you do end up using something pretty similar to what you're suggesting. So you use a difference in difference model. Have you come across that in your studies before?
Briefly.
Okay, so you use a difference in difference model to evaluate the program. And that lets you pick up the causal impact, exactly as you were saying, of greater access to Sure Start. So you find that hospitalizations fall by 10% in poorer areas, but the effect in rich areas is not statistically significant. Can you think of any reasons why the impacts might be so different in these two different types of neighborhoods?
If you think that, so let's say what Sure Start is giving is kind of, interventions in childhood to help them develop skills. For example, you might think that there's falling marginal returns, so that the first few interventions give you a lot of benefits, but as you go on you get less. And if you think that in rich areas those early interventions are being done by the parents or by a paid childminder or something like that, what Sure Start adds is going to have much lower kind of additional returns on top of that, whereas in poor areas those early investments can be really, really valuable and it's a much higher marginal return at that point.
Yeah, absolutely. That's a really good point. And do you think that it matters at all that the centres were concentrated in more disadvantaged areas, particularly at the start of the programme?
You might worry perhaps about whether there's, let's say if all the Sure Start centres in poor areas are done in year 1 and all the rich Sure Start centres in rich areas are done in year 7, there might be something different going on kind of just in general, like a national change that's happened over that 6-year period, so you might worry that they're not strictly comparable. I would guess that doing it kind of at a neighbourhood level in lots of poor areas at once might help kind of attendance rates, if it kind of gets at some of the stigma maybe about people not wanting to attend these sort of services. So is that what you mean?
Yeah, so I think the point about whether the take-up rates are different is really, that's a really good point. I want to push you just a little bit further on the first point you raised about a national trend in year 7, the national circumstances in year 7 being different from year 1. So in a difference in difference, we would typically include something like a year fixed effect from year to year. So can you just explain a little bit more what would need to be true for that to affect the estimates that we'd be picking up?
You would want that to be kind of, the year fixed effect should hold for poor areas and rich areas. It shouldn't be something specific to either. And if there was something specific going on in rich areas in year 7, say, that might make you concerned about the validity of your estimates.
Yeah, that's absolutely right. Great, thank you so much. That was a really, really good conversation and a really good set of answers. Thank you, Ben.
Thanks.